In this video, we will review the steps of the driveline dressing change. I'll start by opening my kit and using the supplies provided in the removal pocket. This will include a pair of clean gloves, an extra set of sterile gloves, 2 hats, 2 masks, adhesive remover, and hand sanitizer. So I'll just set that extra pair of sterile gloves to the side in case I need to use them for anything. Always want to do good hand hygiene. You can use soap and water, or you can use the hand sanitizer provided in the kit. Main thing is we want to start with clean hands. Next, I'll place a cap on myself and a cap on our patient, as well as a mask on myself, a mask on our patient, just to make sure that we are maintaining that sterile environment. We want to ensure that we practice good sterile technique in order to decrease risk of driveline infection. So now we're ready to move on to the removal phase. I'm just going to put on my clean gloves or non-sterile gloves to remove the old dressing. So with the clean gloves, you don't have to put them on any special way. Then I want to grab my Freederm adhesive remover just to help loosen up those edges of the dressing. Kind of helps break down that glue and just makes it a little bit easier to remove the dressing from their skin. Helps prevent skin breakdown, things like that. So you just want to apply it around the edges and it'll kind of help dissolve that glue. Then we're ready to remove the dressing. You just want to gently kind of pull around the edges, remove it off. There's really not a special way to pull it off. There is a perforation in the bottom of the dressing that you can kind of use to get started, but then you just want to remove it, just taking care to not pull the driveline. You don't want to cause any trauma to the exit site. Just kind of work your way around, pulling it off. Sometimes that little disc will get kind of stuck to it, but just take your time, pull it off, and so you can see where that little tear is. You can try pulling it apart there and then removing that disc. Then for our anchors only have to be changed every 7 days, so we recommend changing them on a Monday just to keep it on schedule, keep it on track. Unless the anchor is not sticking well or it becomes soiled, you would want to change it before then. So now we have our old dressing removed, we're ready to open up our application pocket. This is going to have all the supplies we need. It'll have an extra pair of clean gloves or non-sterile gloves, so we'll just set those to the side because this portion we want to become sterile. So I'm going to set my hand gel and my sterile gloves to the side before I open my kit. I don't want to put on my sterile gloves until I have my sterile field open and prepped, because everything inside this kit is sterile, so I don't want to touch it with non-sterile hands. So we're going to do some good hand hygiene again. Again, you can use soap and water, or you can use the hand sanitizer that comes with the kit. Then we're ready to put on our sterile gloves. Now these are going to be put on a special way. So we do have a separate video on this page of how to properly put sterile gloves on if you want kind of a more step-by-step, but this is different than just putting on the clean gloves because we want to make sure that we don't contaminate the sterile part, because again, we are trying to keep this as sterile as possible to prevent any type of infection or issue with the driveline site. Alright, now that I have my sterile gloves on, we are ready to clean and dress the site. So first thing I'm going to take is our ChloroPrep wands. To use these, you squeeze the little wings, it'll crack the solution and run it down into the sponge there. You want to start and work your way from the inside out, so right on top of that exit site, and then just work your way out in circular motions, scrubbing the skin really well. Then I want to take the second ChloroPrep wand and repeat those steps, starting from the inside, working my way out. You'll see I grab a gauze in my right hand, and I just use that as a barrier to help stabilize the driveline while still remaining sterile. You want to allow this to dry really well on the skin for at least 2 minutes. And then while that is drying on the skin, I will get my silver square ready. This is just helps with infection control. It's antimicrobial, helps keep away bacteria. And I want to place it silver side down against the skin. So just using that slit there, kind of guiding it around the driveline. And again, you'll see me use the gauze to lift the driveline without contaminating. Then the next thing I'm going to grab is the barrier film. And this is just to help prep the skin for the dressing. So you just want to take it around anywhere that adhesive is going to stick to the skin where the dressing is going to lay. So not necessarily right on top of the exit site, but just that surrounding skin. Then we're ready to apply the dressing. So first I'm going to grab the bigger piece of the dressing, what we refer to as the shirt. On the back side there, you'll see a little strip. I want to hold on to that because that's going to come into use later. I just want to place that window of the dressing right over the little square. You want to center it in that window. And then you'll pull down the bottom half of the dressing. Just doing it that way, removing that backing in that order, kind of gives you a little more control over the dressing rather than removing both of the little tabs on the back. Just easier to place the dressing down. So this portion is we call the shirt. So we've laid our shirt down, making sure all the edges are smooth. Then I'm going to grab the bottom part of my dressing, which we refer to as the pants. And I want to peel off just one of those tabs, slide it up under the driveline as if I'm tucking my shirt into my pants. Then peel off the other backing of the other side of the little wing, just again to give you more control over your placement. Make sure that's all smoothed out. Then this portion that was on the back of the shirt, this little strip here, we refer to as the belt. So you have your shirt, pants, and belt. Your belt will just kind of seal those two pieces together. Then I want to take my second barrier film to prep the skin where the anchor will go. So I want to prep it. You want your anchor to go on the abdomen in a way that's going to guide the driveline in the natural way the driveline's laying. You don't want it to twist, bend, or kink itself. You definitely never want to put the anchor on an extremity, so never put it on a leg. Try to avoid the crease of the hip if you can, or where the pants are going to be sitting at, because the anchor here is going to provide that extra stability for the driveline and just to protect it from any trauma. You know, if the controller were to drop, this will just add that extra layer of protection to prevent any major accident. And there's your dressing.